introduce the webinar. After my introduction, I will give the floor to my colleague Martin uh, for a small presentation of CFSOMI. And after Martin, we give the floor to John for the rest of the time to moderate the webinar. Thank you so much, John, for your availability. And I want once again to thank you, all of us, to join us for this webinar. I don't have no more word to appreciate your engagement because we have a very, very good subject that we want to speak about this morning on the clinical assistance provided by the Global Fund. It's a very, very important aspect of the work that we've done every day. If you can receive this technical assistance from the Global Fund to support our community to more engage in global fund processes at the country level, it's very great. So we want to give more information to all the CS who engage the fight against malaria to continue to work with community, to work with other network, to work with the CCM in order to more involve community in the global fund processes. So it's very important to all of us to receive this information to know how we can ask, we can do a good request for the technical assistance. It's for this reason that we have the support of ENASO today. That's the regional hub for English-speaking country in Africa to explain more about this technical assistance. And we have the really great opportunity to have an ability listener for the Global Fund that will give us just a summary, a summary of the technical assistance before discussion. But when I'm saying before to begin to speak about technical assistance, we want to do a small presentation of CSM. And for this point, I will give the floor to my colleague, Martin Morgan, for this presentation. So, Martin, you have the floor.
Thank you so much, Fidel. Thank you, everyone. Thank you to all the participants. We know that we are quite busy, but you have taken your time this morning to come and participate to this webinar. I want to especially greet all our colleagues from South Africa, Nigeria, Kenya, all the countries represented in the chat, and even those who have not yet written their name in the chat. As Fidel just said, I'm going to do a really brief presentation on CS4Me. What is CS4Me? I'm doing the presentation about this movement of more than 900 civil society organizations and network from 48 countries that are all committed to eliminating malaria. At CS4Me, we believe that it's not acceptable that hundreds of thousands of people continue to die every year from a preventable and treatable disease. And so, henceforth, we are committed to strengthen the capacity of communities, civil society, and elevating their voice to support national global effort to eliminate malaria. We have in our strategic plan a vision that is going till 2030. Is a 5-year vision, which is to make sure that national civil society and communities are recognized as bold and creative catalysts of change and are supported to drive people-centered national, regional, and global malaria elimination effort. And the mission of the coalition is to harness the power of a global movement of civil society, organization, communities to achieve malaria elimination. For CS4B, membership is open to any local civil society organization or network based in the malaria endemic country that represents malaria-affected communities. So if you are here and you know an organization, CSO, which is not yet affiliated to CS4Me, who have not yet joined the coalition, don't hesitate to share when we will share in the chat the link to join. Member CSOs vary from emerging community-based organizations, religion groups, to Global Fund sub-recipients. And as organization, you can join individually or as part of a network. So CS4Me complement rather than compete. We are not here to compete each other, but we are here to complement to make sure that we are really a strong force to fight malaria. Our leaders and members also include members of community delegation to the Global Fund Board, developing NGO delegation to the Global Fund Board, Global Fund Youth Council, Global Fund Youth Advisory Council, Global Fund CRG Advisory Group, ALMA Youth Advisory Council, ABRIEM Strategic Communication Partnership Committee. And we can assure you that as member of CS4Me, if you are really active, if you are really participating and having a meaningful participation, you can find yourself in some interesting advisory group or platform really to express yourself and the needs of the communities. The objectives of CS4Me is firstly to strengthen CS4Me member capacity and commitment to achieving malaria elimination is the first objective. The second one is to build civil society influence with CCM's NMCP in at least 11 high burden, high impact countries, which we have already done till a point where we are just waiting few countries to join in order to make sure that we have those task force, those platforms in countries where civil society is really influent and can talk to the government. Also, the third objective is to demonstrate the capacity and impact of civil society in at least 5 countries through a sub-grant mechanism, and which we already attained through the community engagements SI initiative fund that is granted by the Global Fund. And also deepen CS4Me's global advocacy presence. This is our fourth objective: advocate for investing in civil society for malaria elimination, strengthen the efficiency and effectiveness of CS4Me. What have we done? Capacity building, which we continually do. You sometimes receive our every month, at least twice per month. You receive link for webinars, flyers for webinar. We also influence at national level by supporting members of CCM to be more effective in the advocacy, and also we make sure that we develop some platform to have a productive dialogue at country level. Also, we have a local impact. We support, learn from, and share community-led initiatives to overcome grassroots barrier to elimination, malaria elimination, such as community-led monitoring, which I'm sure most of you here on the call already knows about, and local advocacy efforts. So we also participate in global advocacy with campaigns. When there are campaigns, like we are already in the aid replenishment campaign, we also make sure that we participate in such a global advocacy movement, and by bringing community voice to the global level, including in advocating for global fund replenishment, as I earlier said. We also advocate for investment, actually. We develop clear message on the importance of investing in civil society and community engagement as a key to malaria elimination. I think that even this training is part of an investment done at the level of civil society, to know that you can ask for global technical assistance, and you are granted technical assistance as organizations. Also, we strengthen continually the civil society, communities for effectiveness and accountability. Now, how to become a CS4Me member. We have a website. You can register, you can apply. We can share with you the link in the chat so that you can apply as a CS4Me member. And once we check your application and you are eligible, you are able to have your certificate or your membership certificate, let me put it so. And this is a very interesting certificate that give you access to our trainings, to our advocacy activities, to all the consultations, dialogue that we have. And as I said, it also grants you the opportunity to participate to global platform, advisory group at global level, national level, regional level, and it's helpful you at the end of the day to raise the voice of your community. So this is, in a nutshell, what I wanted to share about CS for me this morning. Thank you, Fidel, and over to you. Thank you so much.
Thank you so much, Martin. Thank you for this presentation of Sales for me. We will share the link to the chat box to join Sales for me. Please don't hesitate to share very widely the link to in your network, in your organization, to allow to other sales so that are not member of Sales for me to join us for a concrete and for our advocate for our global advocate to more involve the community in the fight against malaria. So now I will hand over to John. So over to you, John. Thank you so much.
Thank you. Thank you so much, Fidel. Many thanks, Fidel. Many thanks, Martina, for a very good setup. Good morning, everyone, and good afternoon for those who are in Eastern Southern Africa region. I'm glad to link up again with everybody, and we are happy to co-host this webinar with our colleagues from CS4Me. And it's a very important and very exciting opportunity for us to share the opportunities that are there for civil society organizations, especially for the civil society organizations that are in the malaria constituency. So we would like to now move to the next session that we had. But before we get there, I would like to maybe just to share with you the
John, now I checked it. Now you want to share the presentation? Annabelle,
yes, I want.
It's okay.
Okay, let me try again. So can you see my screen?
No.
And
Yeah,
now?
yes, John. Yes, we can see it. This is, yeah, there's somebody sharing the screen. Yes.
You can see my screen, right?
Yeah.
The
Yes,
PowerPoint.
okay now.
Okay, thank you. Thank you so much, colleagues, and sorry for that interruption. Now, this I think it's the main objective of this webinar have been shared by my colleague Fidel. And just to recap, is literally to just share opportunities that exist for accessing TA by communities. And for this, I think we also have a focus on malaria civil society organizations. This is very a good opportunity for institutions that implement and support malaria programs within the Global Fund settings to be able to access TA, and that can enhance their performance and also increase their engagement in Global Fund programs within their countries. So it's a very good opportunity. We targeted the civil society organization, community-based organizations, key vulnerable populations within the malaria sector, youth-led organizations that are really active in supporting Global Fund programs, human rights and gender advocates, and national programs representative for HIV, TB, and malaria. Sometimes we implement, some CSOs implement across these three epidemics. Now, what we're going to use this morning, this afternoon, one, we're going to have a very interactive approach where we'll have very short presentations and allow for quick input, quick feedback. Then we can also have a session where we're going to listen to experiences. There are some civil society organizations that have actually benefited from this tier, and we are very glad to have them here. There's two representatives who will share their experiences on this tier, and maybe some 2 pointers on what needs to be improved, strengthened. And we'll also have a walkthrough step by step on how now if a civil society organization is interested in accessing TA, what they need to do, the procedure, the documents, we'll also share in this presentation. And then we'll also have now a dialogue, open it up for discussions and people to share their knowledge or ask more questions for clarity. So this is the format for this meeting today, and I'm glad to say I think we are ready to go, and all the ground rules apply. Now, as we get into why do we need to actually have this session? The main reason is because the Global Fund itself has identified the need for communities to continue engaging in Global Fund programs and processes across the grant cycle, not just in one stage. And I think most of us who are here today, we have participated in one way or another in the country dialogue and in the design of Global Fund grants. But most of the times, once we submit that, we now, most civil society are never engaged. It is only the PR and the SRs, but some other organizations are left behind. But what is the best approach to ensure that these civil society organizations participate across the grant cycle, from funding request development to the implementation to monitoring to everything? So there's availed this tier under the Community Engagement Strategic Initiative. It is a short-term tier to be able to allow to build the capacity and strengthen the communities and civil society organizations to be able to continue engaging in the Global Fund process across the cycle. So for this session today, we want to share with you that opportunity. How can we get on board and how can we access this this tier? So now, just to take a step back, just to have an operational definition of what TA is, and I think for all of us, we understand TA is an extra support that an institution can get to be able to enhance its internal capacities as an organization, and also build the organization of its staff to be able to deliver on their mandate effectively. And for this, the purpose of the TA from the Global Fund, it targets the institutions that can be able to continue engaging, even if you are not an SR, but you can continue engaging in Global Fund processes throughout the cycle. So that building that capacity, sharing resources, we'll see some of the tier areas that as we proceed. Now, so this will so there are two types of TA under the Global Fund Community Engagement Strategic Initiative, that is under which the CRG falls under. So there's a long-term tier and a short-term tier, but today we are talking about the short-term tier, and this is within 30 days, but can be spread across 3 months of implementation. So the goal from the Global Fund, as I mentioned earlier, is to ensure that communities continue to engage and play an active role throughout the Global Fund grant implementation cycle, not just in the funding request development or grant making. No. Throughout the cycle, so we don't lose any CSO, we don't lose any participant in the process. So who can apply now for this? So we see now it is networks of organizations led by vulnerable populations within the context of, sorry, we've forgotten to add the malaria. Actually, that's my bad. So the networks, organizations of people who are affected by the 3 epidemics, youth-led organizations, women-led networks and organizations, civil society networks and organizations closely working with these groups and within the malaria, TB, and HIV. So these are the organizations that can apply. And this tier is dedicated for communities and civil society like all of us here. So the tier is dedicated for us, and in one way we support interventions around malaria or TB or HIV, and within the Global Fund space. And even if we are not SR of PRs, but we still contribute and support the national responses. If you're in Nigeria, even if you're not an SR, you still support the grants in one way or another, because we understand these epidemics are a multi-stakeholder approach, and all key stakeholders within the sector are important. So these are the institutions that can apply. So what areas in terms of just guidance is we need to look at the areas that are aligned within the national priorities. If we are in a malaria implementing in a country, these are priorities that are within the national priorities and the Global Fund programs. And then the proposals activities should clearly reflect the community needs. These are literally community interventions. So these are the areas that we can qualify. But let's get deeper into that and see what we can apply there now. What type of technical assistance can be requested? Now, any CSO who is interested in situation analysis and needs assessment can apply, okay, within the malaria. Let's say we want to look at the situation analysis and context within Ghana, in malaria issues and all that, so that we can generate that data and use it as evidence, okay? So we need to have that. For example, we have CRG-related assessment to generate strategic information that is data for now can help us to plan or to support the Global Fund programs. Programs reviews to ensure communities' perspectives are also reflected in some of the programs that we have. So that is one pillar where we can apply. So if you're interested to see what is the country context now, and generating enough data on malaria, and that can help you as a civil society to participate and play a key role in national programs and within the Global Fund malaria programs in your country. Then you can say, I'm applying for this, you can put an application and go there. Now, the second part of where we can apply, engagement in country dialogue process. Now, this is, I think we all understand this, and most of us have participated in this. So if the country now is ready to do funding request, there's normally country dialogue. So, and sometimes civil society cannot access resources for country dialogue. You'll see our counterparts, let's say the government side or the development and technical partners or the international NGOs, they have resources to be able to participate in that country dialogue. But most of the times the civil society, national civil society, lack these resources because most of our money are always attached to projects. So when the country is ready to develop a Global Fund grant funding request, now there we don't have resources to go into these meetings, participate into the workshops. So this is some of the area we can apply. So for example, the civil society maybe in Zimbabwe, they can apply for support to caucus, to come together and now look at what priorities do they have. So they can say, we want to support some money to be able to have a consultant and workshops for us to be able to come together and identify our priorities within the malaria issues, okay? Then that can go in there. Or another organization can come in and say, we want to consult and coordinate our priorities to ensure that at least we have things that we can now go and support in the funding request. So that one is an area that we can also access resources for. And also now, within engagement in planning, strengthening, and participation of Global Fund related processes, other than just the funding request, we can also apply for this support. So we've seen this second area is literally to design programs to help the civil society to play a role and participate in designing programs. Now, we all understand that the Global Fund funding request and the programs are always informed by the national priorities. Now, in Nigeria, the Global Fund grant is informed by the Nigeria National Malaria Strategy. Okay, so if you miss to contribute to the Nigeria Strategic Plan for Malaria, then it is a gap there for you to go into the Global Fund grant planning or funding request development, because most countries refine, update their plans, and they go into the Global Fund application. So there are resources here now where communities and societies can apply and to be able to influence those national policies, guidelines, strategic plans, because they understand the influence and inform the funding request. So these are resources that we can apply for. And also, I've just mentioned within the specific funding development of the funding request process. So, for example, there is writing team is there. Well, do we have the civil society in Kenya coming together, or in Tanzania coming together to develop their priorities and go to the funding request country dialogue and present the priorities? Okay, so if you don't have resources for that, then we can apply and say in the malaria constituency in Tanzania or in Kenya, they want to caucus and harvest and capture contributions and proposals to go into the funding request. So that one can go and they can apply and access resources to support their movement, support the workshops, the consultations, and also to support for money for a consultant to be able to help them in that process. The third area is support to design and implementation arrangements, where we have the civil society mapping. And I think, colleagues, for those who are in malaria constituency, this is very important. The only way to have a strong malaria civil society movement in a country is to know each other. We can't avoid that, is to know each other. If we look at our brothers and sisters within the HIV and AIDS sector, they're very vocal and very together. But if you look at the malaria constituency civil society, in most countries, we are one, few, two, there's no really strong coalition. So the only way to start that is to map and see who is there, because most of them, we don't know each other. So we can be able to map the civil society organization in your country. I think there's a time Malawi did this kind of application. They applied and say we need to now map the civil society who do malaria in Malawi, so at least we can have one, we know each other and we know how to engagement framework, engagement modalities, we can engage and work together. So this is another area where we can apply for that kind of support. And also, we can also use these resources to look at activities, interventions that we think are relevant for our sector, and these are interventions that we think should be able to be factored in within the national processes or the Global Fund processes. Then we can also apply to refine, validate tools that can support community engagement in GF-related processes. And of course, this support can also support our workshops to be able to generate knowledge, train. For example, if we have malaria civil society organizations in Botswana or in Ghana that don't understand the Global Fund, the knowledge on Global Fund, how the Global Fund works, is limited. Then these CSOs can apply and say, we need a training workshop to understand how does the Global Fund work, both at the secretariat level and the country level. How do we engage with the CCM? How do we participate in funding request development process? How do we apply to be a sub-recipient? What do we need to strengthen ourselves to be able to be a sub-recipient or a PR for that matter? So these are funds we can apply to understand those processes and understand how to get involved and participate more effectively as a civil society organizations. So these pillars are the three areas that we can apply the resources. And as I mentioned, these resources are earmarked for civil society organizations within a country. And eligibility, we've seen this literally community groups and civil society organizations, and we don't have like development partners or government applying for this. This is resources that are dedicated for civil society organizations. And these are the areas that we can apply. Now, we have seen how the areas that we can look for resources in terms of tier. Now, I want us to quickly look at what are the step-by-step process for applying now, okay? So we're transitioning now to action. So we know the Global Fund has community engagement strategic initiative that has a component of short-term tier. That short-term tier, we have seen, it is targeting to enhance the community engagement in Global Fund processes. We have seen that. We have also seen who can apply, and we've seen the areas of application where we can apply if we have a need in these areas, okay? So now, how do we apply? How do we access this tier, okay? The first is we look at our need. What do we need? What is our need as civil society? a network of malaria champions, let's say in Ghana or any other country in Africa, can internalize and look for the need. What is the TA needs that we need? Okay, so we define that properly and we capture it in a way that is very precise and very targeted. Okay, so we have defined our TA. Then we consult amongst ourselves in the country. Okay, let's pick an example of Zimbabwe. So the Zimbabwe CSOs, let's say one CSO in Zimbabwe that has seen a need of, let's say, mapping of civil society organizations in Zimbabwe that work within malaria. They identify that as their need. Then they go to the next step. They have to consult with their other stakeholders. That is the other civil society organizations in Zimbabwe that do malaria work. Then remember, in every CCM in a country, we always have our malaria representative in the CCM. Okay, so we now also will work with this malaria representative in the CCM and tell them, inform them that we are trying to apply for this. If this issue comes in the CCM, please just tell them you understand and you know. So they work with the CCM member, their representative within the CCM, and they share the idea, the intentions to apply and all that. But they also work with the other stakeholders within the malaria constituency, other NGOs, and say we are trying to apply for this, so we want they discuss, they get ideas, so at least it's a country-owned process and it benefits the constituency. Okay, then we go to the now third step. You have the first step, you have your idea. The second step, you have consulted with the stakeholders, including your CCM representative at the CCM. The third step now is to now take the pen and fill up the form. So there's a TA request form that is there, and I will share with you at the end of this presentation, that you take the form, now you start writing and complete the form. Now, as you complete this form, the Global Fund has, this is very important, colleagues, the Global Fund has requested regional learning hubs. There are regional learning hubs. I will also share with you the regional learning hub that exists in the region and which regional hub you should work with. Regional learning hubs are institutions that work at regional level that have been mandated by the Global Fund to enhance community engagement in Global Fund processes. So these are organizations that are regional in nature. There is one that works in Anglophone Africa, all the English-speaking Africa. It supports them, CSOs who are in English-speaking Africa. One, it shares information, it supports learning, it ensures that communities are engaged, and they continue playing a key role in Global Fund grants. So this regional hub, now when you are ready to apply, you will get the form, and please work closely with the regional hub in the one that is for your region. For example, for all of us who are here, if you are Anglophone Africa, then your regional hub is the Anglophone Regional Hub. It is based in Arusha in Tanzania, and it is hosted by an organization called IANASO. So I will share also with you the contact for that person who is the focal person for that regional hub. So if you have the form now, you have downloaded, you are ready to apply, you complete the form, working with the regional hub focal person. The reason why you don't send it directly, immediately, as your first draft to the Global Fund, is that this person at the regional hub will help you to fine-tune it and put it in a way that it avoids a lot of back and forth. You send and then the comments come, you send and the comments come. No, because they understand those applications. So they will work with you slowly on the application form. They'll have meetings with you, 1 or 2 meetings with you. Then when your form is in good shape, then they'll tell you now, please, you're ready to submit. Okay, so that's the third step, is filling the form. But we understand filling the form, there's a resource that is available for you, which is a regional hub to help you to fill in the form. Then we go to the fourth step. The fourth step now is now this is an internal Global Fund approval process, which is now will take your application and ensure you are review it against the eligibility criteria and all that, and then they will approve and award. Then we go to the final step. Now you implement your tier. If these are workshops that we're doing, if you're doing dialogue, a series of workshop dialogues for malaria communities, then you now start implementing. Now, if you had there's a consultant that have been attached to you, then you will work with this consultant. Now, as I want to take you back a little bit, once you submitted your form and it has been approved, there's a technical support providers who have already been identified by the Global Fund. They've been pre-qualified. So there's a list of, I will share with you also, of technical support provider. So that provider will now work with you to implement your job, okay? We'll get the consultant for you, but you will do the rest of the things. Your workshop, everything, you'll be now coordinating and do all that. But they will be get a person to help you throughout the process if there's a consultant that is needed. So this is the 5-step process. And don't worry, I will also share you a detailed document on this so that at least you can be able to make a reference on this. Now, important to note, when you're doing your application, please make sure your application is very clear. The objectives are very clear, targeted, and the deliverables you can actually have very tangible deliverables. Then your application should be relevant to Global Fund priorities. Why? This support has been set, even if you are not a PR, you are not an SR, but you can still apply. But when your application should now be able to be relevant to Global Fund priorities. If we're talking about ending malaria or community interventions in malaria, then and this is contributes to the overall goal of Global Fund, that is to eliminate malaria, then this opportunity, that area is clear. So let's not get out of the priorities of the Global Fund. And most of the times, the priority of the Global Fund is always the priority of the national priorities. Because remember, we mentioned we normally use the strategic plans for the country. Then the most important part is the application should reflect community engagement. Remember, these are resources that are earmarked for communities, for civil society, community groups, networks, those ones. Make sure it reflects those responses, community responses, okay? You can't apply for something like for the Ministry of Health, because these are resources that have been earmarked for communities, and the community stakeholders need to play a key role. Then, of course, this time submission. But don't worry so much on this first box, because you will be working with the region, as I mentioned, the regional hub that will be able to give you more support. Then we also seen there are some best practices that you may need to follow. Make sure your request is aligned to national malaria priorities, for example. Then use evidence, so you demonstrate where the need is. For example, the malaria civil society have very limited knowledge on Global Fund in your country. So you need to be able to prove that. The engagement is very weak. The participation in Global Fund is minimum by the malaria constituency. So we want to make them active, okay? So, or we want to look at the ignored, the key populations that have not been captured very well in Global Fund, and you want now to bring this, have this as a priority. So you have to demonstrate that we have women of reproductive age and young children interventions that are missing in the country grant. So how do we bring them up? Okay, Kenya, you want to look at the climate change and the impact in malaria. So you have to now have that data. So you have to have something that can justify, which is very clear and very straightforward. Then engage relevant partners in planning. Your fellow civil society, engage them, bring them together and in planning. and also be very specific and results focused. Now, I'll share with you where to get support more. There is that. I'll share this. I think we will upload these slides in this discussion, and also other relevant. I think we'll upload a number of 5 documents on this platform. Then you can download them as you go. So the 5 documents that we're going to share. One is the guidelines for application. All this I have summarized. There's a document that has them. Then the request form, I'll share with you. Then we'll also share with you an example of a very good application. Okay, so there's a form that has already been completed, which is considered one of a good application. So we'll share with you so that at least you have it as an example when you're doing your application. Then we also share with you the learning hubs that are for your region, but for everyone here who is from the Anglophone Africa, your regional hub is hosted by IANASO, is an organization, a regional organization that is based in Tanzania, Arusha. That is where we are. So that is a regional hub, and it will be the one that will be supporting you. There's a focal person who was supposed to be with us in this meeting today, but unfortunately, she could not make it. She's called Grace. So Grace will be your focal person, will be your very first person to go to, and she'll be the one who providing, helping you to complete the form as you apply for your TA. Then we'll also share with you the list of TA providers, and that list of TA providers now will be able to just give you some information on that. I've put this is Grace's email, so you will have it as we share these slides. So that's our email address. Anytime you want to you ready to apply, you are ready to ask for these resources, you just reach out to Grace. Now, there's one thing I want to mention, colleagues, to you. I think I started mentioning this when we started talking, but let me go back there again. Having seen the number of organizations that have applied for this TA, it is evidence from our end that it is the HIV civil society organizations and it is TB civil society organizations. Very few malaria-specific organizations have applied. Okay. Now, as we are here together as a team, please, this is a resource that is available not just for the TB or HIV constituencies, but also for the civil society in malaria subsector, and who really want to engage and ensure the grants within that country are performing well. I said you don't have to be a PR, you don't have to be an SR, as long as you are a civil society organization that works within the malaria constituency or HIV or TB, please apply. So we are encouraging and we really want to thank CS4Me for this opportunity to speak to the malaria constituency. I think it is their mandate. They've done a very good mandate, a very good responsibility from their end to ensure that the civil society organizations within the malaria constituency are not left behind. So thank you so much, CS4Me, for this, for bringing up, I mean, we are, how many? We are almost 85 people participating in this, which is amazing. And most of the times when you see 85, we only see these big numbers in the HIV and AIDS CSOs or TB CSOs. But most of the time, malaria, we are really not very visible. So this is one of the very good strategic approach by CS4Me for ensuring that at least we are also bringing the malaria civil society organizations up front. And we can share with you a lot of experiences where you go to a country and you are looking for malaria CSOs. The only strategic partner you will get is the division, the Ministry of Health Division of Malaria. They become the CSO. But where are the malaria CSOs? And it's one of the biggest epidemic in the region. And even when we are talking about ending HIV in 2030, we don't know, we don't see the end of malaria. And it's one of the most public health challenge in our region, where malaria is, I think it's one of the biggest cause of morbidity and mortality, especially among under 5 children. Then the question is, where is the community here? So this, I think, is a very good demonstration for me for highlighting this and bringing the stakeholders so that at least we can be able to access some of these resources as well as our colleagues within the TB, HIV, and the TB and HIV. So I would like to also now share some few other, just in case you are interested. Now, we have talked about this. There's also, unfortunately, and this I think is a slide that we've been using, and this is before the changes within the American policy. UNAIDS technical support mechanism that was there, but it was mainly focusing on AIDS, HIV, but I think these ones are not providing TA anymore. We have the French, this is mostly, but sometimes we see them working within the English speaking. So this is also an organization, an opportunity for TIA, for free TIA. I think for those French speaking countries, they understand this and they support Global Fund programs within that country. They offer free TIA. We have Backup Health, that is by the Germans. They also support delivery of TIA. And then within the TB constituency, we also have the Stop TB Partnership Technical Assistance. So we have a number of them also as well, but for us, most important, we will mainly look at these two, the backup and the French 5% initiative, but mostly French-speaking countries, but we've seen sometimes they work within other countries that are English-speaking. Now, so that's for me, and I would like to maybe we can pick a few questions here and there. So at least if you have any question for clarity, we should be able to provide clarity. And as we are doing that, also please put your questions on the chat box. We can also still look at them and respond. So at least we can also all of us have the right information going forward. I will also upload the documents, as I mentioned, as we discuss. So I'd like to open it up for any questions or point for clarification. You could, is Liz with us? Liz,
Yeah,
my
I'm
colleague
here.
Liz,
Yeah, I'm
okay,
here.
that's fine. Okay, that's fine. So you could maybe also help me to check the chat box and see.
Sure, definitely.
Okay. Okay. So colleagues, welcome for any point for clarity and questions. I can't present. I can't see the hands.
If there is a question on Q&A, if you go to that tab, there's one question there.
Oh dear. Do I know how to do Q&A?
Maybe
It's on the
yeah, maybe stop.
Is it on the chat?
Yes, on the Q&A icon. It's just after share button.
Okay, just hold on.
Maybe stop sharing. Maybe that could.
Oh yes. So stop sharing, then Q&A. Okay.
Yeah.
Good. So we have a question from one of us. That is, I would like to get clarity on something. The presentation on CS for me, it was mentioned that any CSO or CBO can apply to become a member of CS for me. My question is, how does this organization engage in malaria activities? Many organizations are members but do not know what it takes to be actively engaged in project of malaria elimination. So I think this question will be responded to by my colleague Fidel. Fidel, I think we should be able to give us that. Then there's another next question is a repeat contact person of IANASO in Tanzania. So I am going to give you that. So the contact person for that is Grace. She's called Grace Ngulube, and I'm putting it in the chat box together with the email.
Hello, John.
Yes, please.
Yes, I think for the first question, I will answer in the chat box in the Q&A
Yes.
directly. For the
Okay.
other question, we can just continue to answer to this question. I see one hand up, Mr. Erasto. I think we
Yes.
can
Yes, please.
we give the opportunity to this person to.
Yes.
Okay,
Please go ahead, please.
Erasto,
Your
you
hand is
can
up,
open your mic.
Erasto.
Yes, you can open your microphone and ask the question. Erasto, you can open your microphone and ask your question, please.
Yes, Erasto Mazella. Erasto Mazella, please unmute and ask your question.
Yeah, I think I just clicked and accidentally. I don't have any question.
Oh, that's okay.
Okay.
Then we have from Ephraim Samuel. There's a please, is the application going to be by individual CSO or by state level team? Now, so the application is one CSO can apply, but the scope of the application should be benefiting the sector, the malaria sector. Okay. So one CSO can apply, but the scope should be this malaria at country level, and also in the application, they should work together with other stakeholders. Yeah, so that is a response to that. Then there's another question. Then there's another question from Abdullahi. Do not know. Thank you for presentation, sir. If my organization cannot meet the criteria, can we do a consortium with other organizations to achieve this goal? Yes. Yes, Abdullah, that is encouraged, and that is very much encouraged. If you think you don't meet the criteria as your organization, then you can come together as a consortium and apply. But remember, as long as you are a civil society organization, CSO, community groups, network, I think you qualify to apply. So, but if you think you don't qualify and you want to have another match consortium, then it's possible. Yeah. So another question. Yes, please. Is there another hand?
John, I see one hand from Salmanu. Maybe you can
Yes.
give the opportunity to Salmanu to ask you his question. Salmanu, you have
Okay,
the floor.
Salman, please unmute and ask.
Thank you very much. My name is Salman Muhammad from Wazobia International Humanitarian Foundation. Thank you for your wonderful presentation, sir. I just came late, but sir, how can we apply? Like we are working, before we are working in malaria now, and our organization is working since for HIV and X. How can we apply? Thank you very much, sir.
Okay, thank you. I think we can do a very quick recap on that. So the application is one, you identify your need, what you really want to apply on. That's number one. Number two, you now talk with stakeholders in your country, other civil society organization that you work with in the same sector. Number three, you complete the form. There's an application form that we are going to attach as we do this session. You complete that application form, but when you're completing that application form, don't worry so much. There is a regional learning hub for your country that is based in Tanzania, Arusha, that will help you to go through the application to fill in the form. So it will help you. Then that application will be submitted. Then you'll be given a response by the Global Fund, and you'll be given the resources to do your work. So that is the very quick process, but I'm sharing with you on this chat also the presentation, so at least you can have more information on that. And thank you for coming in, even if you came in late.
Thank you very much, sir.
We do have a question from William Tua. What is the duration of TA implementation?
Okay. So the duration for TA implementation is it goes for the short-term TA is 30 days, but the implementation runs for 3 months. So you can have your money for 30 days, but you can implement it up to 3 months period.
And can a local NGO apply as well? That's Helen Atta asking.
Yes, Helen, a local NGO is encouraged and it can apply. Local NGOs that are civil society within the country can apply. And I think these resources are actually for local non-state actors, the NGOs and civil society. Yes, not international. So it's local. So if you're in Ghana, if you're in Tanzania and you're a CSO, yes, you can apply.
I think, I'm not so sure. Salmanu, your hand is still up, but your question was asking, how can we apply for HIV? Did you mean HIV-TA? That was Salmanu's question. How can we apply for HIV?
Yes,
Yeah, so
yes, it's already answered the question, ma'am. Thank you very much.
Okay, thanks.
Now, Francis Victoria is asking, is it only Malaria Civil Society Network who can apply because of the capacity and coverage?
So no, it is not only the malaria civil society networks can apply. Even a civil society organization in malaria, you can apply. But the scope should be, you should work with other stakeholders within the country, the other many stakeholders within the countries. That will be including the other CSOs in malaria and also the networks also, you can work with them. But you, as one single CSO, if you're not a network, as an NGO supporting malaria programs, yes, you can apply.
Perfect. That takes care of Olayinka's question. Tafik says, thanks for the presentation. Please give more light on how individual organization can receive direct technical support in addition to the one from Coalition of Networks. What are the criteria that needs to be met?
Okay, so this, so an individual organization can receive, as I mentioned, and the process is the same. You just take the phone, apply. The criteria for you to be able to demonstrate, you need to demonstrate that you are going to receive the TA, but it is not just your organization work. It is supposed to be the work that can improve the malaria response in a country. So it is not just your work. It is, for example, one CSO in Nigeria can apply, but that work, what they are asking for example, they can ask, how do we get malaria? We want to get malaria priorities for Global Fund, then which is good, it's covering the country. We want to map out civil society for malaria in that country. You see, now that is, the scope is bigger. The application is one organization, but the scope of that application is helping other civil society organizations as well. Yes, any other? Liz, can you see any other?
Yes, I've just seen to my Nile Mangi saying he's more than happy to help any Tanzanian organization before sending their request to the Learning Hub. Okay, so maybe this is more of a clarification from Ogidi Nicodemus. From your presentation, 2 or more CSOs cannot apply from a particular state or community. He's asking it as a question. If yes, will the TA funding support be shared among the consortium CSOs that applied under one CSO?
Yeah, so it is encouraged to work together and identify one need. That is what is encouraged. If 2 organizations apply and their needs are different, then those applications are considered. But if the need is one, then it is always good for them to work together and have one application. But if the need is different, here we want to engage in the development of a national strategic plan. We want to participate in the Ministry of Health strategic planning. And the another one, they want to do mapping. Then that's different, then they can apply. But if the need is the same, we're always encouraged to match and work as a team. Yes.
Yeah, we've covered most of it. So you're good.
Yeah. So any hand up, you see?
None so far.
Okay. Yeah. So colleagues, as we proceed, I would like to now get us into the next session to get one of our colleagues, 2 colleagues, to share their experiences in this and who have already applied. Just a very 3 minutes each for him to be able to share. So I have my colleagues. Yes,
hello,
please.
John.
Yes, please.
Yes, I think before the testimony, we can give the floor to Annabelle to present for the presentation before the testimony.
Oh, thank you, and welcome, Annabelle. I was looking for Annabelle. I couldn't see in the beginning, so we just skipped the session. Sorry, Annabelle, if you were there and we skipped you.
Yes, no
Sorry.
issues, John, and thanks for the opportunity. I think most of the information has already been covered about the short-term technical assistance, but I just wanted to maybe go to a couple of slides. I don't know if someone from your side is sharing the slides that I shared.
No, we have you can share
If
from your
not,
end,
I can share.
Okay.
Yeah. Okay. I know John has shared most of the information about the short-term technical assistance channel. I just wanted to share with you some more details about the mechanics of how we actually implement the short-term technical assistance. So once we have received the request at the secretariat level, we review the request together with country teams and other colleagues. And if it's approved, we can move it forward and develop terms of reference. If it's not approved and you find all the eligibility criteria in the guidance notes, then usually we provide some feedback and have to unfortunately decline the request. If it's approved, we then reach out to one of our 19 pre-qualified TA providers. These are all civil society and community organizations, and they can provide TA in a range of different regions on a range of different topics. So in the upper left corner here on the slides, you see all these organizations, and many of them can actually provide technical assistance, particularly on malaria in the Anglophone Africa region. The TA providers then identify potential CVs of consultants, which we will share with you to make sure that you approve the CVs, and then we move forward with contracting. I also just wanted to show you very quickly some of the data about TA implementation. So as you know, we can implement TA across all regions and countries receiving Global Fund grants. And I just wanted to back up the point that John made earlier about short-term TA and the limited levels of requests we're receiving from CSOs working on malaria or with malaria-affected communities. So in the upper right corner of the slide, you see the number of TAs that we had completed, ongoing, or approved by end of last year, and you see quite a high number of requests on TB and TB-HIV, and a much lower number of requests on malaria or integrated requests. What we see oftentimes, and what we also encourage for some processes like funding request development, we really encourage countries that have Global Fund components for HIV, TB, and malaria to send integrated requests, where we then support more of a cascaded TA with pre-consultations for different constituencies and then kind of cross-alignment. I just wanted to come also, and I'll speak not to the actual TA menu of what is eligible. John spoke to that in great detail, but I just wanted to flag some things that are not eligible for TA. For instance, we can't support strengthening of CCMs, things like CCM elections, or like strengthening of oversight committees and things like that. We cannot provide long-term capacity strengthening or organizational strengthening of civil society networks and organization. And that's important point to note. I know that there is often a lot of need and demand for this type of work to strengthen, for instance, financial management, monitoring and evaluation, develop organizational strategies or plans. That's, however, not eligible, given that, as John mentioned, the TA shall really benefit a community beyond an individual organization. And we can also not, for instance, support the actual writing of the funding request. Usually the TA that we support is delivered in a period of around 3 months, and we need 3 months to mobilize it. So if your malaria national strategic plan is being reviewed or a new plan being developed next month, that's really, really tight timeline for us, and most likely we would not be able to deliver on it. That's why I encourage you to really think ahead about when does your NSP end, for instance, when is the country likely to review it, so you can request the technical assistance well in advance. And the support we can usually mobilize is for around 30 expert days. We work, and that's a really important principle for us, to work with local experts wherever possible. So we try to work with experts from the country or region of assignment. And wherever possible, we also try to work with experts when it comes to HIV, particularly with specific lived experience of the population that they are working with. I'll not speak about the TA process, but I just wanted to give you a couple of examples, and we go to country speakers as well in a second, of what we supported. In Guatemala, for instance, we supported engagement of communities most affected by malaria in the development of the Grant Cycle 7 malaria funding request. So it was interesting because there are really not a lot of malaria CSOs compared to other regions, Francophone and Anglophone Africa. So the consultants really needed to do a lot of mobilization work to mobilize other organizations that work with groups particularly affected by malaria, for instance, pregnant women, parents of children under 5. In Solomon Islands, we had one example where the TRP, the Global Fund Technical Review Panel, made a question or raised a comment and was saying that gender and gender-related barriers were not fully considered in the funding request when it comes to the design of the malaria program. So they asked the country to do a rapid assessment on gender-related barriers to malaria, and we supported this through short-term technical assistance. It led to a report with very concrete recommendations on how the grant could be adapted to better consider gender aspects in the malaria grant. And lastly, one example from Thailand around access to services for migrants and indigenous populations. That's very population specific and we are doing like a data collection and co-creation approach to develop strategies on how to overcome the key barriers that these populations face when accessing malaria prevention and response interventions. I just wanted to share very briefly an example of a TA that we're in the process of supporting around national strategic plans. So for instance, here one country wanted support for communities to engage in the end-term malaria program review and in shaping the new malaria strategic plan. So some of the aspects of the work that the consultants are doing is to train then civil society and community representatives on what is the process to engage in the end-term malaria program review. What does global guidance and WHO or guidance, for instance, say about this process? Then we aim to support a process of identifying community priorities for integration into the new national strategic plan, and then support kind of joint strategizing and collaboration around organizations and networks to come to these processes and speak with one voice. And we are particularly also considering the national strategic plans as one entry point, given that in many contexts, Global Fund grants strongly focus on national strategic plans, and with reduced funding, global funding for 3 diseases, that will be an approach that we can, or the national strategic plans will even become more important as a point of orientation. I wanted to share just a couple of questions for reflection. If you're thinking about applying for technical assistance, you can ask yourself, when will the country that you're living in revise its malaria strategic plan or develop a new plan? If you don't know, you can reach out to the malaria constituency, other members who are also the National Malaria Program, to better understand the process. Make sure you have the right information on the timeline. Another question you can ask yourselves is, when did the country submit its application for Grant Cycle 7? So that is the grant cycle that we are currently in. because from that you can draw some conclusions on when the country is likely to submit in Grant Cycle 8. We don't know yet exactly how GC8 will look like and what the timeline will be for country submission of country funding requests. However, you can start thinking about when you submitted it last time and think back. And here on the right, I just posted a couple of countries that submitted back in 2023 in the first submission window. And then lastly, last question, has your country received any comments from the Global Fund technical review panel that are related to the malaria grant and somehow related to civil society and communities? Now, this does not only have to be comments related to, communities were not involved, we are unclear if community provided inputs, but this can also be very key comments around, for instance, raising that the grant in some way is not or has not been very effective in ensuring that specific populations, earlier I was saying migrants or indigenous populations, for instance, the grant has not been very successful in reaching these populations. So you could think about working together with the CCM and with the national program to help elevate some of the experience from the ground and from communities on the ground to the decision-making table to make sure that the grant can actually be really more tailored. And I want to leave with these reflection questions, and maybe just a last reflection question. Also, we talk a lot about CCMs, we talk a lot about NSPs and technical working groups on malaria, but some of you may also be involved in subnational decision-making around malaria, subnational tailoring discussions. And we haven't received a lot of requests in that area, but I wanted to flag it here because maybe there's also an opportunity to ensure that some of these subnational strategies, communication strategies, behavior change communication, etc., is well informed by community input. So if you see any opportunity or have been involved strongly in any of these processes at subnational level, would also be really interesting for us to learn from you. And I'll leave it here and handing over to John or Fidel.
Thank you so much, Annabelle. Thank you so much. And I think by mistake, your presentation has come in, has clarified most of the things. I think it's in order, and I knew we were supposed to come first, but I think this has worked very well because there's some of the things that you explained we had not included in our presentation, which has really added value. Thank you so much, Annabelle. So in case we can open for maybe 1 or 2 points for clarity, then we can now move to the next session. You can type in your question, and if you needed any more clarity.
Yes, I think we can take maybe 1 or 2 questions from participants.
Yes. So I can see Salmanu Muhammad. Your hand is up.
Thank you. Yes, sir. Thank you very much, sir. But please, can we have the slide, sir? Can you share us the slide of this wonderful presentation to our sir? Thank you very much.
Okay, that's fine. And I've already uploaded a total of 5 documents on this chat. Maybe you could also try to download it from there. And also, I think, Fidel, since we can share with you all this, you could be able to forward to the team that is here.
Yes.
Any other rural integrated development? I can see the representative from rural integrated development.
Yes, you can open the mic and ask your question. Oh, we have Ellen Ajambo. Okay, Ruhal, you have the floor, please.
Hello.
Yes.
Yes, hello.
Yeah. In fact, I've been listening attentively. I also been thinking of getting many other civil societies from other states to come together so that we now form a strong body to be able to come up with where to put up an application. Because I've been so versed in only my own state, Taraba State in Nigeria. And I'm seeing it as a strong organization. There's need for a strong coalition to come up with a stronger force to face the challenge of fighting the malaria issue. So thank you very much. All I need, this slide, please should be shared to us so that we'll have more time to sit and more attentively to get more from it and also come up with ideas on how to face this challenge. Thank you.
Okay, thank you. The material will be shared, and we also appreciate the need for building these coalitions, working with networks that ensures there's a national reach and responding to our national priorities. Yes, Helen Adhiambo.
Yes, so thank you for the opportunity. And my question was, by subnational strategies, do you mean like the technical working group that maybe take place within the counties that we have? Like our organization is part of the malaria technical working group. So from the technical working group, we get feedback from the healthcare providers and the in charges who work within the facilities and other civil society organizations on the state of malaria and how the end user is getting is benefiting from the malaria programs that are within the county. So is it the same thing or it's a different thing?
Okay, so thank you, Ellen, for that question. I think this is directed to Annabelle. You want clarity on subnational. Is it devolved units like districts or counties, depending on the country you are? Yeah.
Sorry, John, I'm not fully sure I understood the question. Is it
Yeah.
about if you can apply for technical assistance at subnational level?
Yes. The institutions that work at subnational level.
I was asking if the subnational strategies are the same as the technical working group that are devolved. Like John was saying, you are saying that we should be part of those subnational strategies, right?
So some of you may already be part of those. I assume that some of you may be part of kind of subnational decision making, because sometimes in these calls we talk a lot about national decision making. We talk about country coordinating mechanisms. We talk about technical working groups at national level. We talk about task forces between civil society and national malaria control programs at national level. But we talk less basically about kind of the mirrored decision making at subnational level.
So the subnationals are the one from the grassroots levels and maybe the devolved function within the counties.
Yes.
Okay. Thank you.
Yes. Any other question?
John, I see a last comment in the chat box from Suleiman on Nigeria. As it's Nigeria is not among those who apply as you presented, Annabelle. Nigeria is not eligible to receive to apply for technical assistance.
Yes, Nigeria is eligible. The list that I showed, it showed the countries that submitted usually early in the grant cycle. So usually in the past we had like 7 submission windows spread across almost 2 years. So every country submits in a different submission window. And I just showed you some of the countries that have submitted in the past in an early submission window, which would also be the countries that are more likely to submit earlier in the next year. So it means that it's good for you to start thinking about these processes a little bit more. And I can post in the chat the full list of countries and submission windows, because for sure Nigeria also submitted, and you will see there's like a big Excel table, and you can see in which window your country submitted in the past.
Thank you so much, Annabelle. I think Suleiman tell that Nigeria can apply now. It's good. Okay, John, please, over to you.
Yes, please. And if there's no other question, I think we can now move to the next session, where we're going to briefly hear from CSOs, malaria CSOs that have benefited from this tier, just to share the experiences in terms of what area it covered, what are some of the benefits, and also what areas that they think maybe we can improve in future. So I'd like to ask one of us here, Titus, to come in. Titus, you could come in and mute your mic and.
We have Eric, like on the list of panelists. I don't know if it's Eric or Titus that you can present.
Yeah, so Titus is the one that was coming first, and then we have Eric Omondi. Titus Ngeno, you can unmute your mic.
I send the link to Titus to be panelist. Okay, it's okay now.
Oh.
Titus can open your mic and take the floor, please. Titus, you can open your mic.
Yes, I hope you can hear me.
Yes, we can hear you, Titus. Thank you. Welcome.
Okay. Just thank you. So this is Titus from Kenya, the Island Endemic Region Network.
Yeah, you could maybe put your presentation on slide mode, so at least we can see.
Which is a coalition of civil society. Okay, sorry. Let me just put it up. Yeah. That's okay now?
Yes, Titus, it's okay. Go ahead, please.
Okay. So my name is Titus Ngeno from the Highland Endemic Region Network, which is a coalition of civil society organizations in what we previously called the Highland Endemic Zone. It basically is an advocacy platform that seeks to increase the uptake of malaria services. Of course, we cannot really overemphasize the role that the civil society organizations play in the health space. And how they shape the design of the health policies so that they align to the cultural context, of course, and as well as the religious and other contexts that are at play at the community level. For the Kenyan context, I think like John has already highlighted, and it could as well be in other countries, that the participation of the civil society organizations that are in malaria space has been not really vibrant enough compared to the counterpart organizations that support HIV and TB. I wouldn't want to make these short remarks to be a book of lamentations. Some of the things that we can speak as some of the success stories in terms of participation of the communities in malaria, in trying to sort of put together the voice of the communities. Sometime in 2017, the concept to source was put up, and with that, we had almost 5 regional networks that were formed based on the epidemiological zones that those CSOs operate. And with that, it sort of formed a platform that CSOs could communicate on what was going on in the malaria space and unify their voice. And building on that, one of the other successes or the milestones that we have is now we have representations of civil society organizations in the sectoral committees of experts under the umbrella of the Malaria Health Sector Working Group. The representation is not really enough. We don't have in all the sectoral working groups, but at least we do have. One other success story that we can talk about is the participation of CSOs in the malaria matchbox assessment, as well as the malaria program reviews, the midterm review of the National Malaria Strategy, as well as the end term that we received from Global Fund, the technical assistance is what enabled in the few cycles that we have had, particularly GC7, we really had the benefit of going into that process with the technical some of the challenges. One, the support that we get to participate in these processes is limited, and it has not been sufficient to have broad participation of the civil society. There's also the limitation in terms of the time when, because like John has highlighted, we have the 3-month restriction, but you'll realize that some of these processes span over a much longer period before you go into, for example, the strategy development. The discussions will have started way before, and of course, the actual process will take a while, and it requires more than 3 months of support, because things will keep changing in the course. Of course, the other challenge, which is malaria specific, is we have very limited understanding of CSS by the principal recipients, and programming that is CRG centered. This is particularly a problem for our instance, because you will realize that the resources that are usually meant for CSS in malaria are anchored under the TB program. It doesn't come under the malaria program, and it needs then, innovativeness of the malaria PR to be able to utilize those resources that are in the other program. With that limited knowledge or understanding, it becomes difficult. And so that's how the civil society have missed out in those resources. We have the regional networks that I've mentioned before that were formed. However, we have not realized because they have almost stunted growth because of limited capacity building. So they have not been vibrant as aggregation of the views of the member organizations and the communities that they serve. And to be able to be effective in the policy advocacy at national level. The other challenge that we have is the skewed programming that doesn't then prepare communities in the non-endemic zones particularly the non-endemic zones to be prepared for cases where you have upsurges in malaria, and which is what the local community organizations would keep track and have mechanisms of responding at community level whenever those epidemics will arise. So those are some of the challenges that we still face as the civil society in Kenya, in malaria space. What then can we recommend? One, continuous involvement of communities in malaria programming. I think we need more participation in not just in the processes that are sporadic or seasonal, like the grant writing and malaria reviews, but we need continuous engagement through the health sector working groups. I think the communities need support to be able to then continuously participate, and that participation enables the communities to be at par with the national malaria programs in terms of the information. So you would realize that recently there is, changes in the epidemiological zones in the country, which changes the way interventions are addressed. But then there is an information gap that is between the national malaria programs, of course, the government side and the non-state side. So there is need to bridge that gap so that we get into the space with, uniform information. We would also recommend that the principal recipients need to be equipped and more aligned to programming that is responsive to gender, communities, and human rights. We would also recommend that to put together the voice of the civil society, there is need to build on the networks that we have mentioned. It sort of makes it easier to coordinate the activities of the civil society organizations. We do need the technical support that we have been receiving, but I would also recommend that there is need then for sustainability, there is need to have additional training or additional community capacity building on other areas, program management, monitoring, data reporting, and that is how these organizations or the communities can then be able to document their success stories and what is working at the community level to enable tailoring of the national policies. What do we think can be done, or how can the technical assistance be of more help on top of what we have done? like you've already mentioned, could we consider extending the period beyond the 3 months so that we are able to participate in these processes that take much longer? Remember that when you develop national malaria strategy, it has been going on for several months. It's yet to be launched and to be disseminated. You would find that there are no plans currently to disseminate it beyond the government organs, and the civil society or the communities would need some kind of support to see how can we disseminate this national malaria strategy, which is a very important document. Like we have highlighted, if we are going to seek any other support, we need to understand what is in this strategy. So it goes way outside the 3 months. The other item that we would assistance, not only for the national level interventions, but if we can have, for the specific regions, the dynamics in the lake endemic region may be different from areas where there is seasonal malaria with periodic upsurges. I think we need to have the technical support for these different zones in a way that we prepare them to their own local contexts and the dynamics in that region. For CSS, again, as already mentioned, the malaria constituency has not really benefited so much. And I would recommend, or I would persuade, that if we can allow requests, that are more of foundational, technical support for the malaria CSOs, because they are not at the same level. Even as we mentioned about mapping, which we have mentioned to identify the networks or the organizations that support malaria, I would think that we need to unpack so that we don't do mapping as the 3 diseases. Somehow you will end up with a situation that, again, malaria gets swallowed by, vibrant organizations that have malaria not as a key, function, but on the side. And you end up losing this constituency. And I would then recommend that in these processes, we try to, unpack and ensure that each of these diseases, gets similar focus. John, I think those are some of the recommendations that we could have. We have a lot of success stories from the TA.
Thank you so much for that. And I think some of those the TA, the experiences and success stories that we've gotten from that TA, you could also share with us. There's a request that I think we need to. Annabelle has also requested for us to be able to share any examples of successful TA support for.
Yes, I would.
Yeah, you saw that. Yeah, so we can still look at that chart and share that, and then we'll go through it again. So in the interest of time, I think we can allow Eric Omondi in very briefly. Eric, just mention the TA that you received from the CRG. What worked well, and what you think, 1 or 2 things that you think maybe can be enhanced. Eric, could unmute your mic?
Thank you.
Thank you. Welcome.
John, are you able to hear me?
Yes, Eric, I can hear you. Thank you. We can hear you.
Thank you, John. I know time is far much spent, but allow me start by saying, me together with Titus, we are really humbled to be part of this great team that chats and works and talks about malaria. And I also want to appreciate Fidel, John, Liz, Annabelle. We've been in this forum with Annabelle for so long. And Annabelle, we really appreciate the support. Thank you. Having said that, my name is Eric Omondi Okoth. And I represent, I don't know, John, whether I can I project my screen or I can just say, because I can do both, any.
Yeah, you can just talk, whichever is easier and faster for you.
No problem, no problem. Because of time, allow me just talk. Eric Omondi Okoth. I'm the director of an organization called Blue Cross Nyatike Community Focused Organization, and also the coordinator for the Lake Endemic Malaria CSOs network that covers 10 counties along the Lake Endemic region. I also represent civil societies at Malaria Health Sector Working Group, which was formerly called MICC. And just as I've said, I'm really humbled to be part of this, and thank you guys also for having me. I want to say that it has not been easy, John, in as much as time is not there. I know we've kept on lamenting and lamenting, but let also continue lamenting, because this is also part of why we are here. If you look at, I was trying to look at the team members, the participants who have joined, and without biasness, you realize that we are very few from this country. Most of the active organizations and the civil societies organizations in this country, that is Kenya, most of them are HIV and TB CSOs. We worked with, we received a tier some days back, just as Titus has said, and we worked together in support with KENAM to strengthen and group civil societies across the 7 stratification regions of the country: the coast, the lake endemic, the highland, the central. I don't want to delve much about that. That is part of the tier that we did. Titus has already alluded to it. Number 2, we also, recently we received 2 tiers. Tier number 1 was to support community involvement in the funding request development. And Titus, who represented the Highland Endemic, we had representation from all the 7 stratification regions, malaria regions in the country. And we participated, we gave our opinion as a success story. It was not easy for our opinions to get into the document. But I really want to appreciate, we were not many. In our hall of 100 people, the CSOs, I think we only supported, we were around 7. So we are being called noisemakers. People don't want to listen to you. But we really want to appreciate the support that we received, because it was from Global Fund that CRG activities must be included together with community activities. That is number 1. Number 2, the last tier that we received on behalf of malaria civil societies in Kenya was for participating, involving CSOs to participate in the review and the development of the Kenya Malaria Strategy 2024-2027, of which we also participated. Allow me say this, because of time, that some of the successes that we received is that there were some our proposals, because before this we had a meeting with the CSOs. We gave our proposals that this is what we think as communities should be included in the document. And I really want to appreciate, for the first time, communities' voices, however little they were listened to and found themselves into the document. A case scenario was involvement of incorporation of CRG, whereby community-based approaches for removing barriers and gender equity, together with human rights, together with utilization interventions, were put in place in line with the malaria matchbox assessment report. Then 2 was engagement of civil societies in malaria and other networks to promote social accountability, the CLM. And we are happy to say that within the current strategy that is going to be launched on 25th of this month during World Malaria Day, involvement of civil societies in CLM in a robust way has already been included there. Another one that I want to say is that we also advocated for advocacy sessions and networking state and non-state actors meetings, and this also found itself there. However, I want to say this. That is step 1. It is easy for it to be there. Of course, it was not easy, but implementation is another challenge. Can I move to the next thing so that I also give time for people also to ask? Is that some of the challenges that the CSOs, malaria CSOs has been having or experiencing nationally and also in development of the TA is that most of the malaria CSOs are only involved, and those ones who are involved are those ones who have grants from either Global Fund and maybe from other development partners, USAID, for example. Those are the people who are being invited for meetings because they can facilitate themselves. Other organizations that don't have resources are rarely, you can't find your space, you have no space. In as much as you can be having a very good idea, you can't have the space. And that is what necessitated us to develop a TA so that we can also be able to support these people who have voice, who have opinion, but can't be facilitated to sit at the national dialogues. Most of them are only being during implementation, but we really supported them and we really continue to support them to be part of the design, monitoring, and evaluation of national discourse and implementation. Number 2, some of the challenges that they also face on top of what Titus has said is, remember, most of them, there are very many organizations doing malaria interventions in this country, limited resources. If you don't have funding from Global Fund, you are not an SR, there's no meeting you will attend. You won't find any space, so you will continue making noise there. Lastly is the high competition due to numerous TA that Global Fund receives. If you look at this, most of the organizations cannot measure up with the big organizations sometimes that do TA and submit it. Allow me say some of the advantages, some of the supports, what worked well, is number 1 is the support from IANASO, the regional platform. And I really want to say they have really supported us. John, your platform has really supported us. And we really appreciate and we will continue to come to you for support. They review the proposal, the TA, before we submit it to the to Global Fund. And quote unquote, let me say this, they have a lens like that one of Global Fund. If they tell you, please, can you remove this? Please, can you input this? Can you explain this? When they tell you, please, now it is okay, you can send it, you will hardly get other questions. Most of them are just those questions. So we really want to appreciate the support we've been getting from IANASO. We also really want to appreciate the availability of substantive Global Fund CRGTA team headed by Annabelle and team. They have really been supportive to ensure that they review the support, the request, ask questions, and give feedbacks. Challenges. Allow me not to say challenges, please, but let me say some of the areas that we think needs improvement. Number 1, it has already been said, but let me just say, most of the TS are for 30 days. And the implementation, just as John and Titus have said, runs for 3 months. And most of this implementation, especially the national implement discourse, most of them are, we rely on the work plan and itinerary of the national team, which sometimes, due to other competing tasks, keep on changing. And two, delayance, sometimes delayance from getting approval and funding from Global Fund. I want to give a scenario like the previous one when we were developing, there was development of the malaria policy and the development of the malaria strategy. We requested for TA to support communities to participate in both, but there was a delayance and we had to join, the communities had to join midway when the strategy was being developed. You come there, you start asking questions. What is there for community? People look at you and ask you, sorry, I thought I was in Kenya. Where has this gentleman come from? Where have you been since we started this time? You can't take us back. And sometimes, you are realizing that the community perception, opinion, has been left out. People have been in meetings and in conferences for the last 2 months because of the layers of approval. You come in, you want to take people back 2 months. It gives back and forth, but that's how it is. Lastly, is lack of full cycle support for some interventions. Some of them, let me use the case scenario, the one for strategy, tracking support to track if it is included in the document. Remember, many a times it is there, but when during submission, it is not there, especially during funding request, you realize that what you proposed is not included in the final request sent to Global Fund. So we need to track this. Track whether it was sent, was it included to the last final draft? Was it sent? Was it submitted? Is it being implemented, or it is just there as any other document that keeps on gathering dust in shelves? So some of the proposed recommendation is, number one, if we can simplify, have 2 tiers of TS. One, just for those community, for local organizations, those ones that are community-based. Number two, Number two is investing in capacity building initiatives for those community-based CSOs, such as training programs on grant writing, project management, which can help strengthen their capacity to access Global Fund and TA support, together with also be able to give out their input, because they're also part and parcel of this. Lastly, if the support can go to subnational and county level discourses. And I like what Annabella said. Remember, previously, most of the funding used to go to the national discourse, national meetings, national activities, whereas in our country, health is a devolved function. So you make national, you support the national activities, but at the implementation level, because health is devolved, there's no support there. But I'm happy to hear that at least there's improvement towards that direction. My last prayer is Nigerian, my brothers from Nigeria, Ogao, so that you also tell us what is it that you guys did to make malaria CSO so vibrant in your country, so that we can also replicate the same in our country. Malaria CSOs is dead. You try, there's no support. Their voices are being stifled by other CSOs from TB and also from HIV. So please, people, our brothers and sisters from Nigeria, give us the medicine so that we can apply it in our country. Otherwise, John and team,
thank you.
I really want to appreciate the support and hand it over to you, maybe for some questions and clarification. Suppose there are. Thank you, and over.
Thank you, Eric, for that very elaborate presentation and very clear proposals, recommendations, and also explaining what the kind of TA you received and how it was very helpful to the malaria constituencies. These are some of the things that I think we need to share for us to see how useful this TA is. Colleagues, I know we've really gone over time. I think with 30 minutes, 32 minutes, and we can maybe rush towards closing this webinar. Maybe if you have any question, please just type it down. And if you can have one or two very quick comments from these two presentations, and then we can close out. Thank you. Anyone who still has one last thing to mention that is led from that presentation? Yes, Gesonko Nyasuguta.
Salman, no, I think you can open your mic and ask your question.
All right, thank you. Thank you very much for their wonderful presentation and the success. But they did a wonderful job. But I think there's more, I want to commend that there's more advocacy and awareness that do that, because I think there's for the challenges, there's some issue pertaining that. But I think if they can continue advocate and create awareness, I think they will achieve more. Thank you very much.
Thank you for that. Let me see if there's any other. Yeah. Anyways, so colleagues, I think we've really gone over time, 33 minutes over time, and we are all still interested in this. So moving forward, I think we've taken the lessons learned, the proposals, we've documented them that relate directly to the TA on how to enhance access to the TA. We have shared the documents on this chat, and we'll still have CS4Me with the documents that should be able to share with you in case you can't download them from the chat. With that regard, I think I'd like to say thank you so much for your participation and maybe hand it over to Fidel for his last comments.
Thank you so much, John. Thank you so much to all our colleagues from civil society. Thank you so much, Annabelle, for your good presentation. We have here just a very, very powerful testimony from Eric and Titus. Thank you so much for this sharing. I learned a lot today, John. I'm sure I'm learned a lot after this different intervention from our colleague from civil society. We are going to the last session of this webinar for the closing remarks. Maybe before, I think I've seen two participants hands up. Maybe we can give the opportunity to take two last questions, John.
Okay. So Awal Ibrahim.
Awal, you can open your mic, yes.
Okay, thank you so much. It's been a wonderful day with a lot of knowledge and expansion in dates. The last speaker, I wanted to respond to last speaker on the best practice in Nigeria regarding the CSO, malaria CSO in Nigeria. I think one of the key things that help us here to be more vocal in terms of implementation and advocacy is one, we had a monthly meeting that almost brings some CSOs together on a monthly basis to discuss gap and also has some, how should I put it, like capacity training on a monthly basis. I think if in Kenya they can enumerate that, it can help the collaboration. It can help the collaboration very well. And secondly, another key thing is maybe the settings of the union, especially the upcoming union here in Nigeria. There was also a lot of meetings from the upcoming national down to the state level to hear about the concerns and also the collaboration in the state. Such also helps a very good collaboration. I think that makes the collaboration to be more effective here in the country. So thank you.
Thank you for that tip, and I think the rest have taken it. Now I think we have come to the end. Maybe my colleagues from the CS for me, could you help us close?
Yes, thank you so much, John. Thank you for this good webinar. Thank you to all participants. Maybe to close this webinar, I would like to sensitize our participants on the last for our future next big activity that we organize now is the Global Annual Malaria Forum 2025 in prelude of the World Malaria Day 2025. So it's a very big event organized by Fair for me and partner to share experience between civil society to receive from the very good institutions like WHO, Global Fund, RBM, the last achievement in the fight against malaria. So we invite all the actors involved in the fight against malaria to register for this big event and to be present the Tuesday, 22 April, to participate to this very big event. So please, we will share now the link to register in the chat box. Feel free to share widely this link in your organization, your network, to be how to join us the 22 April for this very great event online on Zoom. So it's the last thing that we want to share with you. And finally, we want to thank you very much for your participation. Thank you very much for your presence, for your availability, for all your experience that you have shared with us during this webinar. Thank you so much, John. Thank you, Lizzie. Thank you for the great team from IANASO for this big, very good collaboration for this webinar. We are open, we are available, we are together. If you have any question on the technical assistant, we have our partner IANASO, we have here for me. You can ask us all your questions if you want more clarification about the technical assistance provided by the Global Fund. We are available for you, and we will continue to work together to improve our collaboration, to improve our action on the field, to permit to the community to stand up, to work together in to achieve our goal to eliminate malaria by 2030. So, John, once again, thank you to you, particularly, and we are together. We will continue to receive more questions from CFO and other partners by email, and we continue to answer to all the questions. Thank you so much, Annabelle, for your presence, and other Eric, Titus, Martin, Sorel, Lizzie. Thank you so much, Grace. Thank you so much for all your support to organize and for this webinar. Have a nice day to all.